what's up guys? I'm Harshita. I'm a final year MBBS student. Welcome back to my channel. Now, this is the continuation of the part 2 of the series. I don't know we should call this a series or not, but this is the second episode of me reacting to medical memes. Today's day was actually very tiring and I am just procrastinating studying, so I thought might as well make a YouTube video, might as well react to medical memes. You'll also have fun, we'll have a lot of laughter, and it will be worth it. So in the first episode, if you have not watched the first episode of me reacting to medical memes, do go and watch that. In that I reacted to like memes which are photo based, like photo memes. But in this video I am thinking to react to medical memes which are of video type, like reels or shorts. Now I can't react to reels because I have deleted Instagram since the past 6 months. So we'll go to YouTube. I have my iPad right over here. I'm gonna go and write medical memes. And I have no idea. Let's get going. Let's watch what we have for today. Okay, let's put the volume up. Is supposed to take patients history in their language, but this is what they say. God, it's so good. It's so true. Especially I can relate to this like with the AIQ people, because like if you're someone living in North India and going to South India for doing MBBS or vice versa, or you're going to completely different state or different country, then I think you will relate to this, because learning the regional language or in like the patient's language is so important. If you're someone who is coming to Karnataka for doing MBBS, if you're someone in the North India and coming to Karnataka for doing MBBS, then please learn Kannada, because I don't know about other states, but in Karnataka people are really concerned about learning the regional language, that is Kannada. So yeah, from first year it's not so difficult. From first year itself you can start a little bit learning Kannada with your batchmates, learning from them, and from second year onwards you can like go to hospitals, talk with patients, and anyway they'll talk in Kannada, so you can practice there as well. And for those people who keep on commenting that why I don't speak Kannada, or maybe they think that I don't know Kannada, ನನಗೆ ಕನ್ನಡ ಭಾಳ ಚೆನ್ನಾಗಿ ಬರುತ್ತೆ. ಹುಬ್ಳಿ ಧಾರವಾಡ ಹುಡುಗಿ ನಾನು, ನನಗೆ ಕನ್ನಡ ಬರುತ್ತೆ. ಓಕೆ, ಐ ಜಸ್ಟ್ ಡೋಂಟ್ ಸ್ಪೀಕ್. ನನ್ನ ಕನ್ನಡ ಬರುತ್ತೆ ಗೈಸ್, ಕನ್ನಡ ಬರುತ್ತೆ ನನಗೆ. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಮೀಮ್ಗೆ ಹೋಗೋಣ.
आपकी शादी हुई है?
नहीं।
नहीं। आपके कितने बच्चे हैं?
बेशरम
सवाल पूछने हैं। आपके बच्चे हैं?
जी हाँ।
कितने हैं?
6।
आपकी शादी हुई है?
बेशरम।
आप
Oh god, this is so relatable, especially for boys when they attend obstetrics and like the OBG postings and all. When they go and take case history, it's so comedy, especially for us females, to watch them taking case history. They'll very like they don't want to make the patient uncomfortable, but at the same time they want to take case history. For example, in our college, like for Karnataka, they'll speak in Kannada words, right? For asking like menstruation history in like gynec or OBG case history taking. So there is this like periods. We need to ask the history of periods, right? When she got her first periods, that is menarche. What is her duration of periods, and how many days flow she gets, how many pads she uses, and whether she gets pain during periods or not, or whether she gets clots or not, heavy periods history, and history of taking OCPs also. All this is menstruation history, which you need to take for every patient, not just OBG, like every female patient we need to take. And I could see the struggle in guys' face when they are like really hesitant to ask this, because I'm someone who's doing MBBS in Koppal, right? And Koppal is still very conservative. It's not very like broad-minded people are not so much in Koppal, like Bangalore and all. In Bangalore, I think almost every person knows the meaning of periods. But in Koppal, you have to ask in pure Kannada words in order to make them understand what you are trying to ask. So in Kannada, periods means like mut. So the way you ask is ಮುಟ್ ಆಗ್ತೈತೇನ್ರಿ, ಫಸ್ಟ್ ಮುಟ್ ಯಾವಾಗ ಬಂತ್ರಿ ನಿಮಗೆ, ಎಷ್ಟು ದಿವಸ ಮಟ್ಟ ಮುಟ್ ಆಗ್ತತ್ರಿ ನಿಮಗೆ, ಆ್ಯಂಡ್ ಎಷ್ಟು ಮುಟ್ ಆಗೋವಾಗ ದಿವ್ಸಕ್ಕೆ ಎಷ್ಟು ಪ್ಯಾಡ್ಸ್ ಯೂಸ್ ಮಾಡ್ತೀರಿ ನೀವು. All these things, like mut is basically periods in Kannada, like pure Kannada. So this word I didn't know before. As soon as I joined MBBS and as soon as my OBG posting started, I got little by little, step ladder wise, I got to know a lot of new Kannada words I got to learn after this. So yeah, this is actually very comedy, okay? Like in surgery department, it's the complete opposite. Like we get a little bit uncomfortable while guys do the PR examination and all. But it's the complete opposite when it's come to OBG. We are really free. Girls are very free when it comes to OBG posting, but guys are very hesitant because all the patients are female and they have to really be careful while talking with the patients. Otherwise, they're gonna get kicked, literally. Next meme.
Quite a few times.
50 times?
More.
100 times?
More.
200 times?
More.
500 times?
Probably.
Biochemistry. No, I can't relate to this because biochemistry was a nice subject, but it didn't make me cry. Okay, it was a volatile subject. I agree. I don't like chemistry. Even when I was preparing for NEET UG exam, I was not at all so much interested in chemistry and physics. Like always, in maths also I was not interested. I was only interested in biology. So yeah, biochemistry it's everything chemistry related, but in medical field kind of this thing, all the test procedure, urine test, blood test, everything that comes under biochemistry. And yeah, it's a very volatile subject. And I think the only two subjects in which first year struggle is anatomy and biochemistry. Anatomy, because it's very easy, but it's very huge. Biochemistry is comparatively less, but it's too much. You have to by heart 50 to 70 cycles are there, like TCA cycle and some glycolysis cycle, everything. I have forgotten everything, but yeah, it's too much. But it didn't make me cry. The one subject which has made me cry in MBBS during studying phase is pharmacology in second year. So pharmacology is everything about drugs, and I am someone who can't by heart. I can't by heart, and pharmacology is about by hearting. You have to by heart drugs. You don't have any other go. Like the entire classification of cephalosporins. Oh my god, I'll put the picture of the classification. How are you supposed to by heart this? How are people remembering this? I don't know. I have huge respect for people who can remember drugs and in one go, not like few years or something. There are people in my batch who like pharmacology and I'm referring to one of my bestie Madhu as well, because he's someone who likes pharmacology and he's someone who can by heart this, drugs uske it's in his tip of his tongue, and I get so jealous of him because I am, no matter how many times I study that drug, you ask me tomorrow, I will forget it. And the drug's name also, oh my god, gives me nightmares of second year. Let's move on to the next meme.
बीपी तो ठीक है,
फिर क्या हुआ?
20 किलोमीटर है.
Like checking the BP, blood pressure with sphygmomanometer is I think the first practical of physiology which they teach you, apart from blood test, hemat test and everything, in which you have to prick your finger and everything. Apart from that, I think checking blood pressure with sphygmomanometer is the very basic of MBBS. मतलब MBBS घुसते से ही the first thing they'll teach you is how to check blood pressure. It's definitely not 20 kilometer, but it is measured in mm of Hg, and there is two terms of it, SBP and DPP, systolic blood pressure and diastolic blood pressure, which is 120/80, which is the normal thing. But first years padho, don't tell it as 20 kilometer, okay? mm of Hg. actually this scene happens in our college also. I think I made a vlog also, like chaotic vlog of like final year, especially during exam application process and no due process. This is the same scene, like same ditto. I have made a vlog. Like my batchmates, they are like crawling over the list in order to sign it. Guys, go and watch the chaotic vlog. Okay, the title is only chaotic vlog because it's very chaotic. And also I have made chaotic vlogs for third year also, third year and final year as well. Both are very chaotic. This is like the most chaotic day which happens in the entire year, like exam application and no dues wala certificate. Okay, on to the next. Let's see the next meme. Bro, this is definitely not Indian medical college, because I am literally, what is happening? Is it really a medical college? This definitely it's not from India. Matlab, are they over exaggerating it? Like the Viva which happens in practical exams of Viva. Comment section, all monsters to the scare floor. I mean students to the practice. Someone is telling we scare because we scare. Seriously. I don't think Viva happens like this anywhere in any Indian college. I don't know. But this is like really scary, bro. At one point of time, I thought some Squid Game is happening. I mean, oral exam or the Viva which takes place in practical exams is very scary actually. It gives nightmares a lot of times. Like the theory exams, you can like really study and pass. But exams are something that is like really scary because of anxiety and so much of things, like 100 things, 100 thoughts are going on inside your mind. And as soon as the examiner asks you a question, it's basically like an interview, and as soon as they ask question, you need to answer. And out of anxiety, if you bluff or if you don't tell the correct answer, then rest in peace. Let's move to the next meme.
Oh, yeah? Well, watch this. Watch this.
God, this is so true. Like in our college also, not the principal but the HODs of like each and every department, they are like your especially during exam application no dues certificate time only, they'll make a list of the entire batch, and whoever's attendance is really low, for them they're gonna like give like last warning like that, and for them they're gonna keep extra classes also so that they can compensate their attendance. It's actually good that they are giving last warning and they're keeping extra classes for the people who don't have attendance. But let's move to the next meme.
This is Dr. Kabir Rajdhir Singh, topper of the college, topper of the board, topper of the university. In fact, he is one of the best students ever graduated from Delhi Institute of Medical Sciences with an impeccable academic record. This is Dr. Kabir Raj.
This is me in my dreams, in my aura life. Me in parallel universe. Seriously. Me in parallel universe.
If I knew that this was going to be the outcome, like I would have never done something like this, but you don't know when you're in the moment, and if I knew that this was going to be the outcome, like I would have never done something like this, but you don't know when you're in the moment. And
this is so relatable. Seriously, me after 5.5 years of MBBS realizing it's too late to change my stream. It's already over. You can't do anything. You have already started MBBS. I still remember when I was in first year of MBBS, there was this one professor who used to come. Like we were just entered MBBS, okay? I don't want to reveal the department name, but there was this one ma'am. Okay, she used to teach us. She used to like teach us, and in the middle of the class, if she hears a little bit of noise also, she starts like scolding. She needed like pin drop silence in the class, and the way she used to like scold us, no, the last word, like fully emotional, she used to scold, and in the end she used to tell like, leave MBBS, still you have time, don't come to MBBS, leave MBBS. And fully, like, she used to, like, fully emotionally she used to scold us like hell. And we were just entered MBBS, like, just we got the seat and we just entered MBBS, we were in first year, and someone is like really telling us that if you can't study, if you can't stay quiet in the class, just leave MBBS, it's not for you, still time is there, please leave MBBS, don't waste a seat. I was like, no, this is crazy. I'll be really honest, from the past, like, I am right now in final year of MBBS, and like, what, 4.5 years. I joined MBBS when I was like in the year 20, and it's like 25 already. It's been 4 years, and still my MBBS is not over. Still 1 year of internship is remaining, and then फिर NEET PG देना है, NEET PG के बाद फिर PG 3 years we need to do, फिर सुपर स्पेशलिटी के लिए टाइम बचा तो वो करना पड़ेगा. It's a very long journey.
ओए मैं तो थक गया इसकी बातें सुन के. अब मैं सो रहा हूँ. जरूरत पड़े तो भी मुझे मत उठाना. गुड नाइट.
Yeah, especially older professors which are there. No, I have seen actually this trend, like older professors who are very like old, senior citizens maybe, they still teach in a way that we don't understand, and it gets really boring and really sleepy in the class. Sometimes I'm opening my eyes and sleeping. I'm like, when will this lecture get over? So sleepy, especially afternoon classes. Paid bhar ke, I'll have my lunch, and after that at 2 o'clock there'll be a class. And at 2 o'clock, whatever class it is, each and every person sleeps like hell. And they'll fight for that fourth row wala bench also, because that fourth row, like, it's continuation with the third row. So people who sit in the fourth row, they don't usually are like visible to the professor. So people in my batch and even my juniors as well, they really struggle, and they fight for getting place in the fourth row so that they can sleep in the class. This is like really true. Absolutely love Dr. Anuj Pachel's like entire personality, channel, everything. He has my like biggest inspiration from first year itself. So let's just watch his memes as well, what he has made on YouTube, and let's see. I'm excited.
Alright, so I have a few other questions that I want to ask you. Did you have any fever in the last 7 days before you came to the hospital? I don't have any sort of fever ever. You're absolutely sure, right? No fever whatsoever. Yes, sir, absolutely not. And also, you have never had the same kind of stomachache before, right? Yes, this is the first time I've had any problems with my stomach. I've never had any operations on my stomach as well. Chalo, I'll just write that down. कैसी है तबीयत अभी? I'm doing good now, but I think after the fever 3 days ago, my joints are hurting quite a bit, especially this one. Would you like to check this one out? And so the place where they took out my appendix from, that place is hurting quite a lot. Did you take his case? No, sir, I have not seen this patient in my entire life before. I have a few other questions.
No, sir, I have not seen this patient in my entire life. This is so true. I have not encountered any such patient in my life. Like, I take the history, and after the exam viva begins, they change their history like in 2 seconds. I have not, fortunately, touch wood, I have not encountered any patients like that who change their history in front of like big doctors and tell something else in front of us. But yeah, I have witnessed this a lot. Like, my friends have gone through this a lot. Like, as soon as we ask them something, they're gonna tell like I remember, I think in final year or third year itself, I don't know, I don't exactly remember, but during my medicine postings, I think there was this patient who was having like severe anemia. Like, I could see the severe pallor in her eyes, and her hands were pale, tongue was really pale, and I took her case sheet also. Her hemoglobin was really low, like 8 or 7, I think, and she was already like getting blood transfusion or something like that. So I asked her, okay, ಏನು ತ್ರಾಸ ಆಗ್ತೈತಿ, ಎದಕ್ಕೆ ಬಂದಿರ ಹಾಸ್ಪಿಟಲ್, ಏನಾಗ್ತಿದೆ ತೊಂದರೆ? And you know what she told? ಏನಿಲ್ರಿ, ಆರಾಮಿದ್ದೀನಿ ನಾನು, ಸುಮ್ಮ ಹಾಕತ್ತಾರ ಇವರು ಬ್ಲಡ್. I was like, what? I asked, she's getting blood transfusions. Her hemoglobin is 8 or 7 or something. And when I asked her what happened to you, why you came to hospital, she's like, nothing. Simply they're putting blood inside my body. I'm like, what? Seriously? I think that's it for today's video because not a lot of memes are there in YouTube, like short section. Everything is reserved for Instagram, I guess. But yeah, as I said, I'm not using Instagram for the past 6 months and I'm feeling very nice, really good. I'm getting so much of extra time as well in order to work on myself and whatever I have on the plate. So yeah, this was all about me reacting to medical memes. I hope you enjoyed it. I hope you had a laugh. Hope this video brought a smile to your face as well. If you have any doubts regarding anything, put them in the comments below. I'll be really happy to answer them. Also put in the comments below what all other type of videos you want me to make. I'll be really happy to make them. That's it for today's video, guys. I hope you liked it. I'll meet you super soon in my next video. Until then, stay happy and keep smiling.